Good morning, everyone. It is great to be here today. Another episode of the podcast of NCIHC. This is the LLD work group. And today we have a special guest joining us from St. Louis, Missouri. And I have Brandi Evans and Jace here. So, Jace?
Yes, thank you so much. And Maria, thank you. And we're excited to have another episode. Today we have a special guest, Brandi Evans. Brandi, while assisting a deaf client over 20 years ago as a governmental grant employee, Brandi found her future in interpreting after that client and a supportive director urged her to take sign language classes. She later obtained a bachelor's from William Woods University and became nationally certified and holds a license as a master level interpreter. In 19 years of interpreting, she has held the role of coordinator, mentor, recruiter, teacher. She serves on committees that empower future interpreters. Given her advocacy and informal leadership with her team and across the Washington University Medical Campus, Brandi was elevated to Language Services Manager in 2023. She has been recognized by peers, physicians, department leaders, patients, and family members for exceptional work and unwavering commitment to equitable and compassionate patient-centered care. Brandi, thank you so much for being with us today.
Thanks for having me, guys.
We're so excited to have you. I have had the pleasure of working with you, Brandi, through my company, which has been an amazing experience. So thank you again for joining us. We're really excited to
Of
kind of
course.
get some perspectives from you from the language access side of uh, lower diffusion languages.
Happy to share. I think
Yes.
sometimes they forget us in the Midwest, right? Everything happens first on the coasts.
Yeah,
And so I love being able to speak from a Midwest. It's happening everywhere, right? The need is everywhere, not just in the coast, not just in great big cities.
absolutely. Yeah, I mean, and that's a great point to make as we dive into this is that indigenous and lower diffusion language access is a universal issue. It's not, isolated to, one city or even just a handful of cities.
Texas. I think everybody thinks like Texas, New Mexico, and that's it, right?
Yeah, California, like a lot of people
Right.
assume, oh, California, I mean, which is right, like as far as Latin American indigenous languages, it is very prominently, a lot more prevalent or noticeable of an
Right.
issue in places like California, but it is,
Right.
uh, at present everywhere, and I personally can attest to that. And then we have Maria, who's in South Carolina, right? And I think probably most people who are wondering about, indigenous language access, wouldn't necessarily think that there's communities of Mayan and other Latin American indigenous language, communities or African indigenous language communities, in somewhere like, South Carolina or Nebraska or Oklahoma. But the
Right.
reality is that it's everywhere.
And that's
So
what makes this program perfect because so we can reach the communities. There's more than what we know of, what we hear of. So this is great. I'm in the East Coast as well, and there's
right.
a big community that I'm still finding out that are, are here around. And so it's just a great way to reach and pass down the word. And so coming
Agreed.
together from different areas of the country, it's wonderful. So it is
Yeah.
great to
And as
have
soon
you
as they
here.
hear you've got a resource, all of their friends and family are going to come, and you realize just how many people speak that language who have a
Yes,
need. Yes.
right. So yeah, it's great to have you with us,
Thank
Brandy.
you. I'm
And
happy to be here.
then this the program as we're talking about the lower diffusion languages. So we like to hear more about you. It is great to meet you.
Nice to
I've
meet you
heard
too.
some from Jace about you, the work that you do, but we'd like you to share with the community, the LLD and the
Yeah. So I
translator
work,
interpreting. So
yeah,
tell us a little bit more about where you're located, how big is your organization, and the focus of your organization, like what kind of demographic do you have, and just tell us a little bit
sure.
more.
Okay. Yeah. So I work for BJC Health Systems. And 2 years ago, we actually joined with St. Luke's in Kansas City. So that gave us 3 states that we now cover because we're located in St. Louis. So we have some areas that we cover in Illinois. We kind of cover across Missouri. And then now we have put into Kansas City, Kansas side by having St. Luke's with us. We're a nonprofit hospital with 28 actual hospitals and over 48,000 caregivers. Um, like I said, we operate across all 3 states. We urban, suburban, rural, across those 3 states. BJH, so Barnes Jewish Hospital, is kind of our flagship or the major safety net hospital downtown St. Louis. That's where our language services team is actually housed. We're lucky enough to have 24 staff interpreters on our team.
Wow.
Yeah, we're
It's
very
amazing.
lucky. And so really we here at BJH, the flagship, we kind of focus on addressing health disparities because in this region specifically, 52% of our St. Louis residents are African American.
Mhm.
And there's 17% of our population where in the city where the families speak a language other than English at home.
Wow.
That's amazing.
Yeah.
Wow.
And tell us a
So,
little bit more how you got involved in the language access and what led you to um,
Yeah.
be in
So
this
Jace,
field.
Jace kind of told my story a little bit. Yeah, I knew a little bit, un poquito of ASL from learning it in elementary school, and kind of kept up with it a little. But if you don't have anybody to practice with, you kind of lose it. And I
yep.
was doing governmental accounting, and a woman who was deaf came in and needed help. And so what should have taken probably 30 minutes took us about an hour to fill out this form. And when everything was done, she says, "You sign pretty, need more words." So I said, okay. So I decided to take a class at the local community college that fall, thinking that I would just have it to support me in my current role. And
Sure.
about 5 weeks in, I was hooked. Like there was no going back. This was going to be my career. I didn't know it was a career. And so here I am 19 years later, still interpreting in the community. I had been here at BJC for about 5 years. We had gone without having a manager for a while. And when my director decided to open the manager position, he's like, "I really want you in that role." And so after a little back and forth, "I don't want to. I think I want to just be an interpreter." And he went, "But you're already kind of leading." We kind of came to the agreement that I would lead. So the best thing about it really is that now I get to advocate for all limited English proficient patients, whereas before I really only stuck to my patients.
Sure.
And so I love when some of my interpreters come into the office and I'm able to ask by name, "Hey, how is so and so doing?" Right?
Mm,
It's not a language I know, it's not a patient I've ever worked with, but now I truly feel invested in all of our patients.
sure. Well,
Right.
that's
And that's
incredible. So,
yes,
so
and that's
you
the
are
beauty of our work that we
Yes,
right.
get to reach when you learn about these different cultures. Like I recently was at a conference where I learned more about the sign language community, and I was amazed and surprised about how deep, like besides of what we just see somebody
right,
signing,
right. It's not
it's
just
a
a language,
community,
it is
it's a
a
language.
culture,
There's
right?
a whole culture, so
Yes.
it's so interesting when you get to learn about these cultures.
I often say, what other job could I have gotten a whole extra family? Right?
Yeah,
Because communities like, "You took the time to learn our language, you're one of us."
right.
Right.
Yeah, and a lot of people might not inherently think of ASL or other types of sign languages as what we would call lower diffusion languages, but they are, right?
Hmm.
We have a couple here who use Arabic sign language.
Yeah.
We don't
And
have an Arabic sign language interpreter here in St. Louis. So we
yep.
have done a lot of, "You teach me what you use for this, I'll teach you what ASL is so that you can assimilate here in the community better."
Hmm.
But it is challenging, and you're right, that is an LLD.
Yep. And as I've worked in the space, advocating more for languages of lower diffusion, more on the spoken side, I've seen a lot of parallels between challenges of getting sign language interpreters and challenges in getting interpreters for other lower diffusion spoken
Not enough
languages.
resource. and a lot
Right.
of need. Yep.
A lot of need, not as much
Yes.
resources, and the fact that you can't really treat your resources the same as you would treat, interpreters and resources for more commonly spoken languages
Right.
like Spanish. You have to treat them differently, and that's just the literally kind of the economy of
Yes.
working with lower resource languages. So very
We
cool.
face it every day.
Right. And I'm very excited to get a little bit more into some of your insights from, we often interview interpreters and speakers of, lower diffusion languages on this podcast, but it's exciting to me to have some perspectives from you, from the role of a language access coordinator, in addition to being an interpreter for
Right.
lower diffusion language.
We've got it all.
Right.
I'm ready.
Right. So, from the perspective of the language access coordinator, Brandy, what are some of the challenges that you faced or seen associated with getting access of language of lower diffusion? How different or similar are the
Yeah.
challenges in finding interpreters of lower diffusion um, versus the languages of more widely spoken?
Resource, right? Let's be honest. The number one most challenging is just resource. Like Jason, I kind of talked about is um, we know that most people immigrate here for a better life, to get away from tragedies back home, right? So the interpreters don't come here first and get set up and get ready for those populations to come here. They
Exactly.
all come at the same time. So as they're coming, you have a need for the resource, but you haven't found it yet. And so that is the biggest challenge, right? Is trying to work with the families. I am very quick to say, do you have a family member who happens to be bilingual? Have they thought of looking into becoming an interpreter? Let me connect you with agent. Right, we're always trying to build the pool of
Mm,
interpreters. If they're good enough to use as family, right, family and interpreters, then let's give them a career that maybe they didn't know existed. So
mm,
that's one thing. Is again, and here in St. Louis, again, people think Midwest. Oh, there's not a whole lot. There's no diversity. We went from 120 languages across our medical campus in 2024 to 146 languages in 25.
mhm.
Most people can't even name those extra 26 languages, right? So to think that we found that much more resource, and again, most of those were lesser diffused languages, right? They were not, it wasn't like we had an additional, and it was, oh, we all of a sudden have German for the first time, right? These
Right.
were languages that nobody had heard of, questioned
Yeah.
whether they actually existed. Is that a real language? Yes, it is. And here's the country where it comes from.
Yep.
Um, and then the second most challenging, and I want to preface it by I definitely have seen improvement in the last couple of years. We just whether it's because we're becoming more popular, we're showing up in TV shows, we're showing up, Super Bowl, those kind of things. So interpreters are more visible. I still think for people to know we exist, to know that interpreting is a career, to know that what we do is a profession. We are not a helper, we're not a friend, right? We have been trained, we follow a code of ethics. We are as neutral as possible. I think that is going to be a continuous challenge. Again, I've been an interpreter for 19 years, and for many appointments I went to, it was, no, you're going to drive them home, right? Or when
Mhm.
you picked them up, did you notice if they had any steps in their house? I sure didn't.
Right.
I met them here, right? So
Right.
just getting that's always going to be a challenge, right? Is just making sure that we are known as a resource and making sure that they understand that we are a professional and we are working in partnership with the doctors, the nurses, the teachers, the lawyers, whatever role it is that you're interpreting that day.
Right. Yeah, I do think that there's still a lot of work, even for your more common languages, commonly spoken like Spanish. You still have a lot of work in kind of educating uh, people on the other side, whether that's the physician or the nurses or a lawyer or a
Mhm.
judge, about the profession of interpreting. And that's, like you said, to know that yes, we are a professional interpreter. We're not like, again, yeah, we didn't pick them up and we're not going to take them home. We don't know
Yeah,
them personally, right? So I think that there's a lot of work to do as far as raising awareness on the other side, as far as like the actual organizations that are in need of interpreters, which is why I think it's really great that you are able to talk with us today to kind of bridge the gap between, you know, what do we need as interpreters, what should we know, and then as a healthcare organization, what should we know, right? And I think that, just like you said, the even just the awareness of your demographic, I think is a problem. Um,
Mhm.
Especially from the standpoint of looking at indigenous languages. Oftentimes it's hard to identify that need because people that speak indigenous languages or, just in general lower diffusion languages, they've often had to work through another language like Spanish or French or Russian or, a language like Swahili that is not their native language, but it is the language that they have had to work through in their home countries in order to, communicate with systems and organizations that they need.
right.
And so it's extremely common for example, with Latin American indigenous languages, the families and the people that are coming to the hospital, when they get there, they're speaking Spanish because that is the language that they are accustomed to needing, being able to get their services in. And also, obviously, if they just start speaking in Kekchi or Chu or their native language, nobody will be able to understand them. Whereas if they speak some Spanish, somebody probably can.
Right.
So I think one of the biggest challenges from the standpoint of sort of the language access when you're trying to ensure that your language access plan for your organization is robust and is really addressing the needs of your demographic and your patients, um, being able to actually identify that need is important because when you look at the sort of statistics, right, you might say, oh, well, we had, 10,000 patients come in and spoke Spanish. But you don't necessarily always get the statistic of, well, they came in and requested Spanish. We got them a Spanish interpreter, but the Spanish interpreter was having a hard time interpreting for them. We don't, I mean, I think from the language access standpoint, you're looking at very high level data for the most part. And so
Right.
it's extremely easy for that to just go completely under the radar. Um, and for no one to really know that this family
We've
is
had that.
right.
Right. So, like I said, people come here and they come here at different times. So maybe, maybe aunt and uncle had been here for a little bit because they could afford to be here, right? So they
Yep.
got here and they got situated. Other family members joined them. The ones who've kind of assimilated have better Spanish, maybe minimal conversational English, even go with them to that first appointment and
Mhm.
they choose to put Spanish as the language. But nobody said, what is your preferred language?
Yeah.
Right? What if when this aunt and uncle can't come with you to the next appointment, how do we communicate with you? Right?
Hmm.
We also have it again, right, where the man has came first and set up home, got a job, found a place for them to live. The
Yep.
man typically works in a field where there are other Spanish speaking. So they
Hmm.
pick that language up because they're immersed in it, right?
Yep.
But then wife comes, wife is pregnant, husband cannot take time off work. Wife has to go to those OB appointments by herself. Spanish doesn't work,
Yeah.
right? You can't
And
send somebody home with 5% of the information.
yeah.
Right.
And even in those situations where the husband is, you know, has some proficiency, I would say that probably the majority of the time it's not enough to,
Basic, right?
yeah. So
It's related to the job, it's slang.
right, exactly. And in addition, you know, they're not a professional interpreter, which means they may say, "Oh, I don't want to tell her that," or
Exactly,
I, I'm just going to explain what I know how to explain. So, I mean, it's obviously not the best. I mean, it's better than having nothing, certainly. But we've moved on from that for like languages like Spanish. We don't accept that as an acceptable
right?
outcome because we know that it's not the best outcome. And
Exactly.
we are still, unfortunately, with languages of lower diffusion, we are far too often accepting, oh, well, we've got a family member interpreting, and we just kind of leave it at that and accept that as an industry, as an organization, and as a society. And our goal in this podcast, and our goal, my goal as a company, and Maria's goal as an interpreter, is to push us beyond that for every single instance that we can. I think it's important to recognize too, Maria, you can, I think you should talk about this. I mean, this is a point we make in almost every episode that the, you know, sometimes asking, well, what is your preferred language it might not even get you to the real answer. And there's a lot of socioeconomic, social reasons for that. Um, and so again, we can't just be satisfied with, well, I asked what their preferred language is and they said Spanish. If we're
We've
seeing,
had to change it several times where, well, they told me
Right.
Spanish.
right,
And for
and
the
if we're,
majority of the Latin America, if you hear them speak another language other than Spanish, you know that's going to be their native language, their
Right,
mother tongue,
right,
because Spanish is the official language for all the Latin America countries.
right,
But if you hear them speak something else that doesn't sound like Spanish, it is
yep.
most likely that there would be a native languge,
The
one
first
when
time
they're
we,
more comfortable, the one they speak
right,
from birth. So
yeah,
so yes, probably one of the um, correct or best ways to ask them, what is your language that's spoken more at home? What language do you speak with your family?
yeah,
And in the indigenous communities, there is the education or lack of education, I should say, like in the majority of the indigenous communities, where I've seen that the women, for the majority, are the ones who don't get to education because the the cultures they are used to, okay, the male is the one who's in charge, the one that's the head of household, therefore he's the one who goes to school some, and the women, for the majority of the families communities, they have very little education or no education at all because they are meant to what is put in our heads is like, you are a woman, you are less than, you are not worth the same, so you have to stay at home, you have to take care of your children, you have to attend the family, so you cannot go out of your home to work, you cannot go to
mm,
school. So the education is one big thing, and so therefore they come to the US not knowing any Spanish or maybe a little, and most of them do learn some Spanish as their way of survival in the
mm,
US. And it's something that you see over and over. And as an interpreter, an advocate, I try to educate the communities whenever I get the chance, and I try to explain to them.
I
And
yeah,
appreciate
one
that.
of
Yeah.
the biggest things I've seen is I'm Maya. So most of the sounds are, if you have an indigenous language, you are Maya, Guatemala, and they don't know that they belong to this group.
Oh,
So
okay.
I often have to educate them, letting them know you come from here, you have a language, you have your traditional clothing. Therefore, you belong to the Maya group. That is something you need to know and mention. And most of them are not aware, which is very interesting.
I'm
and
glad to have you.
yeah, and I think it's important to mention too that very frequently with indigenous communities, because of socioeconomic pressure and discrimination and oppression, it, being able to speak in the more dominant global colonial language is very much a status symbol, right? Because indigenous communities have been conditioned to think, oh, you're dumb, you're uneducated, you're, savages or whatever that's been the narrative for the last, hundreds, if not thousands of years. Um, so a ton of indigenous people that I've interacted with have had this sentiment of kind of being ashamed of their cultural heritage, being ashamed of their language.
I'm one of them.
Yeah, and I'm so glad, Maria, that you have been able to, retain your language and reclaim your heritage and be proud of your, your culture because yeah, I
A
think
role
it's
model
it,
now. I mean, you're speaking up, you're in places that they would
I
never
am very
think
thankful for
anyone Mayan
that,
would
that
be.
I did not lose my language because there was a time, as I mentioned in one of the previous podcasts, where there was a time where I felt like, why do I speak this language? Why do I come from here?
Mhm,
And I was ashamed of who I was due to the discrimination that I had to
mhm,
face growing up and transitioning. So that
mhm.
is something we do see a
There is
lot
not
still.
one patient or one provider who's ever been embarrassed. They have probably been so blessed to have you show up.
Yeah, and so realistically, that sentiment that is very prevalent in so many different, not just Latin American indigenous cultures, but indigenous cultures from around the world, it's
True.
very similar. It's the same,
Mhm.
and that results in challenges for language access because people are ashamed or maybe afraid of discrimination, right? Or maybe they want to show, well, I am educated, and they may feel that they do speak a decent amount of Spanish or French or Mandarin or Russian, but it is almost, most of the time it's still limited proficiency. And that's something that, I personally and my company and Maria, we have really tried to emphasize to our partners in language access is that we need to get used to the concept. We're very used to limited English proficiency. As an industry, we always talk about that. But what we don't talk about is the concept that within limited English proficiency, you can absolutely have limited proficiency in another language. So limited proficiency in Spanish, limited proficiency in, Russian or French. And we don't accept when someone has limited English proficiency, we don't accept that, well, they speak a little English, so that's fine. We've moved past that point, but we have not reached that level for other languages of lower diffusion. We're still at a point where many, many, many times as companies or as organizations, we accept that, well, I mean, it seems like they do speak some Spanish, or, right, that there's a family member who can speak it pretty well. So, it's fine. It's not a big deal. And it's easy to get, you know, because I think that the key issue is that yes, in an instant where there is no other option, and we're going to talk a little bit about this, Brandy, with some more specific stories that we have.
Yep.
But obviously, in the moment, we have to use what we can,
Right.
and we have to do the very best we can to get the best outcome. But I think the challenge and what we need to do as an industry is identify, okay, we had to use a family member for this language this time. Let's try and make it so that doesn't happen again. And me as a language access coordinator, what can I do to prepare our organization so that when this happens next time, we're not using a family member? And I think, far too often people get really complacent about languages of lower diffusion, and they kind of get this warm fuzzy of, oh, we were able to get a family member who was able to help and how great that we got it all taken care of and they left the hospital and it was great. But we don't know
The
the
great four.
right. We don't know, the reality of did
Right.
they actually understand? Were there any questions that they had that were not answered? Are there, potentially going to be complications? And this is, this isn't just, at the grocery store asking about the price of food there. I mean, this is like
Right.
critical, important healthcare stuff. So I think this is a good segue to ask you, Brandy, um, like what have you, from your standpoint as a language access coordinator, how have you been able to find success in both identifying the needs, the more niche needs of your
Yeah.
demographic, your patients, and then providing the resources? What have you guys as an organization done?
Yeah, we are so lucky. Like I said, we are one of the few hospitals in the Midwest that have staff interpreters. So we
Right.
have 8 Spanish interpreters, some of them from more rural. And so, like Maria was mentioning early, sometimes they hear just a couple words and like, that's not Spanish.
Mm-hmm.
That's not Spanish. Give us a second, right? And so I've heard stories of them grabbing a map, right, and trying to find the region. Or sometimes, like you said, minimal enough Spanish to ask, what's your language, right? What do you prefer? And so being able to capture that. So thankful, and we also do a lot of education here. Like with nurses, like with the residents nurses, with the medical providers, I present. We partner with Washington University School of Medicine here in St. Louis. I'm very lucky that they have us come over and present to their med students. And so lots of education about um, it's not just Spanish. There's a
Mhm.
lot of languages other than Spanish.
Exactly.
So we don't go into all of the details of what languages there are, but just helping them to recognize that if you speak Spanish as a provider and you're trying to communicate and it's not going well, they probably don't speak Spanish as their primary. So just
Yeah.
getting that information out there first.
Yep.
Second, having our interpreters very aware. So they know quickly the minute they hear something, they're like, hold on, let me call my manager. They're going to reach out to Maya Bridge and we're going to find out what language, or we're going to get you the interpreter that you need.
Right.
And then, like I said, the other piece is I have such a great team. So my director, Christopher Fan, has lived all over, super bright guy, kind of the person you want on your trivia team. And so him, and then Buddy Sultan, who's one of my interpreters or one of my supervisors who came here as an interpreter. He's a Kurdish and Arabic interpreter.
Oh,
The
right.
three of us, when you're really passionate about what you do, right? It's not just your job that you come and clock in from 8 to 5, but like you love and breathe what you do. For
Mhm.
us, it's like, don't tell us we're not going to get that language, because they'll call because they're supposed to, right? Hey, we have a patient who speaks this language. You're probably not going to be able to find it. The brother's here. Okay, we'll go ahead and use the brother for now and document the reason you're using the brother is because language services doesn't have an on-demand resource. And then I hang up and the three of us go, all right, bet who's finding it first. And so like LinkedIn has been huge, to be able to just go in and type the name of the language, right? And I'll admit you see a word written, but you don't always know how it's pronounced. So thankfully I can type
Yeah.
that language. And that's how I found my abridged to begin with, is I had typed in, I think, interpreters for Guatemalan languages, because we
Yeah.
learned that where this patient was from, and then saw the extensive list of those languages. The language we needed was there, and I'm probably going to pronounce it wrong, so I apologize, but it's shuf.
Yes.
And so, okay.
You nailed it.
So, yeah, thanks. So that was one of the first ones that had came up, that we had a woman here and we had never seen the language. We looked at it like, is that real?
Yeah.
And again, Maya was able to get us an interpreter within, I think, an hour. And it was huge because the clinic messaged afterwards and just said, like, we really didn't think you were going to get someone.
Mhm.
And we're like, we couldn't have promised we'd have gotten it that quickly, but we'd have found it, right? We don't stop
Yeah.
after an hour, right? We keep
Right.
looking because that patient deserves it.
Yep.
I think I had it that I was going to discuss it at another question, but I think an important thing is BJC's motto is because every moment deserves exceptional care,
Mhm.
right? That's the motto of BJC Healthcare. And so every moment, not a moment when it's convenient, not a moment when you have the time, not a moment when, it didn't take a lot out of you, every moment. And so we've been very lucky. And then we found another agency out of, I think, Minneapolis. It's University Language Center. I'm
Mhm.
not sure if you're familiar with them. Okay.
Yeah, I've heard of them. Yeah.
Yeah, they also have been super great about some of the languages of lesser diffusion.
Mhm.
We don't have a Hmong population in St. Louis.
Right.
We had our very first Hmong patient this past year,
Yeah.
and we had no resource locally.
Mhm.
And so they're right there where the population is. So they were able to get us somebody, I think, within like 4 minutes.
Yeah.
Or, we have Grebo, Hausa, those are not as common to
Sure.
find. And so
Sure.
um, I would say the biggest piece of that is now that we have those resources, man, being proactive has made all the difference, right? When one of those languages comes up now, we don't really worry a whole lot. We're like, oh yeah, let us send a message to Jace's team. Oh, let us send a message to ULC. Like, hey, just let us know what time. They're not on demand, but if you let us know this afternoon, and 98% of the time it works out, right?
Yep.
The other 2%, it might just need to be that we need to adjust the timing, right?
Mhm.
Based on where that interpreter might be.
Sure. Yeah,
So
I
the
mean,
proactive, big
yes.
piece.
And I think, so I just want to comment a couple things of what you said. I mean, I think first of all, it is extremely important for healthcare organizations to be proactive. And, I think kind of the biggest issue that we see is that everybody has a main vendor. All organizations have their preferred large vendor that handles, their top 20 and does a good job and has the iPads and and can provide in person and all that great stuff, which is amazing and it's awesome and they do wonderful work. But the kind of the issue that is in some ways harmful to language access is that the large vendors will, they're trying to claim like, yeah, we can do all these languages. But when push comes to shove, it's not because they are so tied up with making sure they're handling their, the biggest languages, that's their focus and it makes sense because it's a need as well. But they'll often put on their list, oh yeah, we can do Chuch or we can do Kekchi. But what they really mean by that is we maybe can do it. And
Yeah,
maybe, usually what it results in is they have a vendor that they reach out to.
right.
Or they might have like one individual that they have on contracted with because it's just not a focus for them, right? Their interest is in in the languages that are bringing in the most
Well,
work.
can I get Spanish connected in less than 4 seconds?
Right. And
Right,
that's great. Again, it's a need and it's something that we at Maya Bridge, we don't focus on.
right.
So having these supplemental vendors that you can turn to for your more niche needs who do have the focus on the the niche languages and that's their priority and their focus,
But
that's
that's best of both worlds for
it,
us, right? For a hospital
exactly.
system
It makes
is
a huge
you need
difference.
something easy, great. You know exactly how to do it. You know where the iPad is, you know the number you have to dial. That's great. You don't have to call us for that.
Yeah.
Here's what you need to call us for. When you type in a
Yeah.
name and it doesn't pop up, we got you. We're, we have a resource for that.
And I think that, BJC is a great example of an organization that has figured it out, right? In terms of you have a great language access team who works to do exactly what it is you do, and you and the other members of your staff are not just working and looking at statistics and saying, we did great this year, we had 95% fulfillment. You're the kind of organization and individuals who look and say 5% is a lot of people
Right,
who not able to get interpretation, and we don't accept that, and we're going to work.
right.
And these are individuals and families in sometimes life or death scenarios. So it's not good enough to say, oh, we did 95%. That's a great statistic. So I just want to point out and congratulate you all for being the raising the standard, I would say, as an
Thank
being
industry.
you.
proactive.
Thanks.
Right, being
I,
proactive.
And
I love to
it's
brag on my
very
team.
important. I
We
get as an indigenous interpreter myself, I get very happy when I hear a doctor. I've come across a very few where they say, I know that they speak another language that is not Spanish, and they are aware that there are other languages. It's very rare that you get to see that, but
Mhm.
I am so happy, and
yes,
this is one of the things that we would like to be able to reach and educate the healthcare providers as well as our fellow interpreters about the importance
a
of
lot of
this
need.
lower
Yeah.
diffusion, the need of these languages. So thank you so much for
Yeah, thank you. Thank you. Like I said, I
doing
like to
what you do.
even our schedulers are interpreters. Everyone on our team currently has either been an interpreter or currently still interprets. So our 5 call center staff, my 2 supervisors, myself, both of our analysts, So everyone came to this with the passion, with the heart for interpreting. And
Yep.
I think that sets us apart probably from some other spaces where your schedulers may have never had to be patient facing and see the frustration,
Hmm.
see that a
Or
patient is
experience it.
dependent, right? If you've never had
Experience
to
in
live
itself.
it.
Yeah, like Maria,
Yeah,
you experienced personally like being in a position where you needed an interpreter, right? Which, yeah, it changes your perspective because man, that really is hard to not, be able to understand.
right.
Yes, that's
So I want to get into this story because it's a fun and cool story that we shared together. So
Yeah.
a few months ago, I guess this was almost a year ago now, my team reached out to me and said, "Hey, we just got a request from BJC. It's a pretty serious request. It's for this language called Kapingamarangi. Have you ever
Oh,
heard?"
that's not how I've been pronouncing it. See, when it's written versus when you hear it.
Listen, it's always hard, and I don't know if I'm pronouncing it correctly, right?
Oh,
I have
okay.
no idea. So don't take this is a language that I have
Okay.
no expertise on, but I think it's pretty close. Kapingamarangi. My team reached out, my scheduling team, who, by the way, I have to brag about my scheduling team, very similar to you guys. Again, all are, bilingual, all are experienced as either interpreters or having to have had interpretation, and are all passionate about the people, right? It's not just numbers and it's not just a job. There's a person on the other end that needs help, right? So my team is amazing. They're superheroes, and I know Maria.
They
I'm gonna
are.
brag
My
about you.
team brags on your team quite often.
Great, I'd love to hear
Yeah.
that, and I'm gonna brag on Maria too because she's too humble to do it. But Maria is also the same way, where I know that she does it. We all I think all three of us and everyone in our space, we do it because we want to help the people. So we got this request for this language, and I'm the same way where it's like, ooh, like this is a fun challenge. Let's see what we can do. It turns out that Kapingamarangi, it's a Micronesian language. It is spoken by estimates are about maybe 3,000 people.
Yep.
And it's spoken,
Spoken. Just
right,
spoken, not interpreted. Spoken.
yeah, spoken, right. There are a total of about 3,000 native speakers of the
Right.
language.
Right.
So this is, I think, safe to say that this is the lowest diffusion language that I personally have interacted with, and that
Us too.
the company that we have come across. So your team had reached out and said, "Hey, we have a really, I mean, this isn't just like a cold, right? It was a
No.
serious, urgent issue." And so I'll kind of let you kind of tell the
Yeah.
story from here, and then I'll
Yeah.
jump in
So
and share our perspective.
yeah, keeping it as confidential as I can, I will just say that it was an individual who needed to have a transplant, right? And we'll just leave it at that,
Sure.
just to give the severity, right? Like you said, it was not a cough. It was not, I need a tetanus shot, right? It was
Yeah.
nothing. It
Or
was
even
nothing
something like
routine.
nothing, yeah, not like, oh, they're in labor where it's like, well, okay, worst case
Women have
scenario.
been having babies for centuries, right? Yeah,
Right. I mean, like they kind of know what's going
right,
on, presumably to
right.
some level, right?
Yeah.
But yeah,
Yeah. And since I know that there are probably interpreters or providers who are watching this who maybe don't have as much interpreting background, when you're talking a language that's only spoken by 3,000 people, you're not talking grab the iPad and get somebody, right?
right.
You're not talking grab the phone and call your local OPI over the phone interpreting agency. You're talking scouring the universe for this resource. Um, we we kept getting phone calls. This is important. We need somebody. Where's it going? How's it at? And we're like, we have reached out to every resource. I found a website online that was like uh, native tongue, I think it was called. They're trying to like bring back languages that are
Mhm.
essentially fading away. I reached out to them and asked, do you have a resource? And they're like, oh my gosh, we did that project like 12 years ago. I don't even remember who the person was for that language.
Right.
Um, and I went home that night kind of defeated, thinking this might be the first one in my time that we can't actually find a resource. And so I'm sitting at home with my dogs on my lap and my phone rings and it's Jace. And I'm like, is this the call? Like, so I hesitantly answer and Jace says, we've got somebody. And Jace doesn't know this because it's a phone call, not a video, but my eyes started watering. Like I'm just crying. I cannot wait to call the hospital back and let them know we found a resource. And it was all in total from the first email that we sent. I think it took like 6.5 hours,
Hmm.
which 6.5 hours to find a needle in a haystack is pretty darn good. It was, everyone was in shock. Like, what do you mean you've got a resource? Like yeah. So again, the feeling of knowing that you can give somebody who's going through probably one of the scariest moments. Because like you said, had it been a delivery, had it been somebody coming in for a runny nose, we
Hmm.
probably would have been like, yeah, we'll do the best we can, right?
Exactly.
It gets to be 5, 6 o'clock at the end of the day. We're like, well, that was an appointment that happened at 3. We'll keep looking for if that patient comes back.
Right.
Clearly, they made it through today. But this
Yep.
was somebody who was admitted and who was scared and had no resource.
Yeah. And so I think it's kind of fun to share my perspective on the story. So, my team is wonderful, but they are also, busy doing a lot of things. And so oftentimes I kind of get called in as like the cavalry of like, we don't know anything about this language or where to find it. And I am, this is my passion as well. I'm very tenacious and I don't give up. And I also just keep in mind that, these are people that need help. And I knew that it was a very urgent situation. And so I had kind of from my end, I'm a single dad. And so I remember I was at uh, I had picked my son up from school and I got this call, hey, we got this really urgent need. And so I'm racking my brain. I'm looking up the language, trying to figure out how can I find it, right? And this is a really, really, really low diffusion, hard to find resource. You're not going to find anything on LinkedIn. You're not going to find anything on any professional website. And I have a good friend who speaks Chukis,
Okay.
which is I don't know if the languages are related, but it is in Micronesia as well.
Right.
And so he's more familiar with that region, Micronesia.
Okay.
And he's helped us in the past when we've said, oh, do you have any? He's an interpreter as well for Chukis. And he's just like me, where he lived on the islands of Chuuk as a missionary, right? White guy, great guy. And so I said, hey, have you ever heard of this language called Kapingamarangi? And he said, yeah, I have. And I said, listen, we're really in need. We got this urgent need. Is there anybody you can point us to that might be able to help? And he's like, you're not going to believe this, but yeah, I actually can. And so the first, I mean, it was like this hours long. I mean, that 6.5 hours, I pretty much was kind of on the phone the whole time because he said, well, okay, I got this buddy. You should try reaching out to them. Reached out to them, and they said, well, I can't do it, but here's a number of this lady. Actually, they gave me a number of a guy. They said, here's this guy's number. He's in Guam. Give him a call. So I was like, I was at Taekwondo with my son and I got the text, hey, give this lady a call, this guy a call. So I'm like out in the parking lot, and my son's in doing his Taekwondo class, and I'm trying to talk to this person in Guam, and he, you know, had pretty low proficiency as I'm talking to him, and I'm like, do you speak English? And he's, kind of struggling to communicate a little bit. He could speak a little bit English, but he was like, yeah, my sister's going to help you. And so I said, okay, well, what do I like? How do I get in contact with her? And he's like, well, here's her Facebook. She's got a Facebook. So I'm messaging her on Facebook, and I'm like, hey, this is a situation we really need help. And she's like, yeah, my sister's gonna help you. I mean, it was like this wild goose chase
But I
that.
think the guy did help us first.
Well, so it was the first person was this woman.
Okay.
I think because she was in Guam and so she was like, yeah, I can do it. And she spoke English well enough that we were comfortable saying, okay, listen, we're going to give you like crash course. This is how you interpret, right? You're going to try your best to do this. You're going to do that. This is kind of like the best case scenario we can come
Right.
up with. We know that this person's not a trained interpreter, but this is the best we can do. And it's certainly better than nothing.
We at
So
least get the patient to know what's happening and to be able to consent,
as best
right?
as
And
we
from our
can.
perspective, those were the two most important things.
Exactly. And so, we gave her the crash course. She did the interpretation. It was like, wow, phew, sigh of relief. And then it was like, hey, we need another, we're gonna need another interpreter, and it's gonna be like at this time. And it just so happened because she was in Guam that it was overnight. And so we said, please, we're gonna need you again. Well, we're gonna pay you, please. And she said, no, sorry, I can't. It's too late for me. And so we said, no, this is like, oh my gosh. And so I'm messaging frantically on Facebook still. And I'm like, please, is there anybody else that maybe can help at this time? Like, we'll pay you. And we were like, we'll pay you like double, like we were thinking like we'll lose money on this assignment from our end, but we don't care. We just want to help. And she said, well, you can contact this guy who was like my sister's husband or something. So she gave us a phone number for another guy. So we, called this guy. And by this point, it's like 8 p.m. And, my poor son was like, Dad, like, I haven't had dinner. And I'm like, I'm sorry, I'm trying to help. And so we got this other guy who agreed to help. And he ended up being not great.
Yeah,
I don't think
just unethical. Um,
in terms of
he
he
didn't know the role. He didn't.
he stepped in for, like this is an emergency and was able to get at least a little bit, but he both from the perspective of the ethics of it, it was very confusing as well because he was like, oh, yeah, I called the family. And we were like, what? You called the family,
Right? How did you even get the family number?
Yeah,
And they're
and then
inpatient.
he was like, you know, demanding payment before he would do any other work. And we said, okay, well, how do we pay you? And he's like, you put it on my card. And we were like, what? What do you mean? And he's like, put it on my card. He was getting really like angry at us. And so we had an issue with him. And obviously, the whole time, my whole team, I'm like, guys, keep going, keep looking. We got to find something that's like viable. And eventually, we found a resource that ended up being a lot better. Who we
Oh,
found from, I believe we found a YouTube video.
oh, okay. I never did find out. So this is interesting to me
Yeah,
how you
this
guys
is
got,
the how
because
the
the
sausage is made.
woman, the last person, was amazing and
Yeah.
was flexible and stayed with, was able to do consent, was able to make sure the patient understood, was able to stay afterwards
Mhm.
and, jump back on a call and make sure, how are you recovering? How it was,
Yeah.
we got multiple emails just saying like, thank you so much. We wouldn't have been able to do this. Yeah, that was a huge, yeah,
Yeah. And so just to highlight, like it wasn't a simple solution. Like we had to go through like four different resources really. And the first one was okay, the second one was not super great. And then, the third one, by the time we're getting to the third one, it was okay, this is a real, viable resource that
and
we
what a great point of being careful about somebody who just happens to be bilingual.
exactly. And our policy is, we're gonna use, and I'm sure that this is what you mentioned as well. We're gonna go with the best solution we can, but we're not gonna settle with that
Right,
forever, right?
exactly, right.
So we're gonna then bring this person in and say, hey, you know, in the case of Kapingamarangi, right? That was the only time we've ever had
Well,
that language.
and we didn't think we'd get one resource, much less possibly three or four you touched base with. So,
I mean, and so, we do this a lot with the different variants of indigenous languages, like Mixteco, for example, where this is the first and only time that we've got this request, and the person we're using, has pretty little training, because, we just found them.
right.
But we're going to plug them in and we're going to help them. Right now there's a gap we need to fill. And then we're going to continue the process of training this person and helping them to develop, the skills that they need. And we're
We
not
just
going to,
used that interpreter again, I think within the last 6 weeks for
oh,
a
no
follow-up
way.
appointment. Yes.
Oh, wonderful. I
So,
didn't know that. That's wonderful.
yeah, you didn't need to. Your team already had the resource.
That's right. Well, as I get, more into the out of the management space and more into the advocacy space, I don't handle as much of the day-to-day stuff. But Maria, I think you can attest to this as well that we have to be willing to kind of, I think a lot of people are sort of sometimes disappointed because they're like, oh, well, that interpreter, was not very good, essentially, right? They were unethical or they didn't look very professional. And sometimes we have clients that kind of will complain and things like that. And this
Sure.
is especially true in courts, where courts will say, you can't ever use that interpreter again. And we say, well, that's like the only one that is literally even available. So yeah, I mean, I think it's really important to be patient. You have to again understand that like we don't have the luxury of being picky and saying, I didn't really like that person, right? Obviously, if we have other resources available, great. But in some cases, we have to say, hey, we need to work with you. There's things we need to change. We're not going to accept forever these issues, but we're going to help you and not just.
Right? If you've got the language pair skill, we can teach you what's appropriate to wear. We can teach you what the role is. We can talk to you about the code of ethics,
Yeah. And
right?
and again, it's important with Latin American interpretation, right? Indigenous interpreters from Latin America, we got to be able to tell them in Spanish sometimes, right? Because not everyone is interpreting into English, which is another,
Right.
kind of issue. So, Maria, what do you think as far as the training and the sort of development of resources? What can we from an industry standpoint and also from the standpoint of like a company like MayaBridge or other interpretation companies, what do we need to know as far as how can we develop the resources and not just, you know, either it just not never have them or, use them but then never, because I just think that a lot of companies that I've seen just are wasting resources because they're not willing to put in that time and effort to go and help and train that person.
Right. And that's one of that's the main thing needed is the training. Some are new coming interpreters who had no idea they could do this, and
Yeah.
they're bilingual, but they don't know the training. They don't know how, they're not trained, so they don't know the protocols,
Yeah.
and so that is that's the most important thing is to train them and coach them. Coach
Hmm.
them as like I've been working along with some other interpreters who I recently met, and I tell them, whatever I can help you with, just reach out. I might not be the best, but from my experience and my knowledge, I'm willing to help you in whatever way I can. And all the trainings. Unfortunately, that as we spoken before, there is not many trainings available for these indigenous languages, but something like in general, give
Hmm.
them the training of what needs to be done and go from there.
Yeah. Well, and just to kind of wrap up that conversation at NCIHC, we at the LLD work group are going to be hosting a webinar in Spanish for interpreters of other languages, indigenous languages, to help talk about some of the key things that they should, know about. And so Maria is going to be kind of teaching this seminar in Spanish, which I'm really excited about because it's not something that happens very frequently. And there are some organizations that are more proactive and are doing that, but we need as much as we can possibly get on that front. NCIHC is also going to be translating the code of ethics that they put out into Spanish for I think the first time, which is again, it's a very important step in lower diffusion language access to realize that we need our colleagues that aren't speaking English. We need them.
Right, because I have a lot of fellow indigenous interpreters in these other languages, Mam, Quechua, Quiche,
Mhm.
who only interprets from Spanish to their native language and requires a Spanish relay.
Mhm.
So if they don't read English, how would they have access to that? So that is,
Exactly.
I'm so glad that they're doing that because that's going to be very helpful. It's going to reach a lot more interpreters who
Mhm.
need the training and the
And
protocols.
And that's the only way, right, that for these languages, right, that we're able to do at MyBridge, we do provide on-demand services even in indigenous languages because we know that, it's again, sure, if you can pre-schedule something or get them, within 4 to 5 hours, if that's the best you can do, then it's the best you can do. But we don't settle for that if we don't have to, and we almost never have to, right? Because if you're focused enough and tenacious enough and have the drive, you can do it. And so that's, what we've done. We have intentionally, you know, tapped into resources that don't speak English, and we have created materials and trainings and hired Spanish speaking staff who then can communicate with them as far as onboarding. Because I mean, you think about it shouldn't be that hard for an interpreting company to be able to communicate with Spanish speakers
Right.
because they have a whole long list of employees that interpreters that speak Spanish, but it just takes that effort of, well, we don't have our onboarding materials in Spanish, or we don't have a contract in Spanish, or we don't have any training materials in Spanish. And so that's something that as an industry needs to change if we want to really get enough resources to be able to meet demands and be able to provide equitable access where it's the same, right? If you speak Spanish, you can get an interpreter in 5 seconds usually, or
Hmm.
we want to get as close to that as we can with an indigenous language, and it's possible. And I think that, I'm very proud to say that we as a company at MayaBridge have shown that it's possible to do with
Hmm.
a lot of languages. It's not always possible with every single language or every variant of every language, but the more resources you have by tapping into whatever you can possibly get your hands on, the better equipped you will be when that situation comes up. So we are approaching our the end of our time here, and we could just sit and talk about these issues, I think, for hours and hours and hours. And thank you so much, Brandy, for your passion that you bring to the industry, to as an interpreter and as a language access coordinator. I think at the end of the day, that's what really it sets you and Maria and the people that are working at Maya Bridge apart is the compassion for that like one person, right? That a lot of times in the big grand picture, it's just easy to just kind of forget about it and say, well, how are
It
we
was
supposed
only one person we couldn't
yeah,
help.
and how, what were we supposed to do? How could we find a Kapingamarangi interpreter? I mean, there's nothing we could have done, right? And so we just move on, right? It takes that compassion and the empathy and the drive then to not settle for giving up. And and then beyond that, as we talked about, it takes, proactivity. We need to be establishing trainings. We need to have better trained staff interpreters who know how to recognize and
Right.
then how to what do they do, right? Oh, I saw that they're speaking another language. What am I supposed to do? Because a lot of times if they're not a staff interpreter, they don't know what to do, right?
Right.
So, having more training from an organizational standpoint to help us to, first of all, be aware that that's even a thing. A lot of people still don't know that indigenous languages are not similar to Spanish. They think
Right.
that they're just like very similar and maybe like a little more, you
Like you
know,
have an accent.
yeah, kind of, right.
Hmm.
I think they do.
So,
They think like, oh, it's from Boston compared to Louisiana.
Yeah.
No,
exactly.
it's not the
Yeah.
same language.
Yeah, so we have, still a lot of work to do, but I think that you guys over at BJC have been a sort of pioneer and a great leading example of showing what can be achieved when you're proactive and when you get the resources in place.
Good
And,
partnerships too, right? When you have a
exactly.
good partnership, there's nothing that beats that because when you have that partnership, again, if I'd have called that agency that can provide me the Spanish interpreter in less than 5 seconds, they probably weren't going to call me at 8:30 at night and tell me they found a Kapingamarangi,
Yeah,
right? Sorry, we looked, we don't have anybody. And that's where it would have ended. But because of a partnership, Jace went, sorry, kid, you're going to have to wait. I know you just worked off 600 pounds at Taekwondo or 600 calories at Taekwondo, but I got to get this taken care of. So
Yeah.
partnerships are important.
Yep, agreed. And the more you
I
have, the
agree.
better, right? I mean, you should never assume like, oh, well, we've got this. Even with Maya Bridge, I mean, I think we do a really great job, and I think that everybody should contract with Maya Bridge. But there's no harm in having other contracts. I mean, and especially in this industry where it's not, you're only paying for services that you use, right? Why not have relationships and partnerships with as many different organizations as you can possibly
Sure.
find?
There are
And then,
resources maybe in different time zones, right?
sure,
You
right,
may be able to
exactly,
get more female versus male to help out in
sure,
OB situations where it's sensitive, right?
absolutely.
All of those things
And if you
make a
have
difference.
and you have an individual that's really reliable like Maria, right? Maria is
Yes,
an individual resource, and that's great for, the Chu community. If you have a huge Chu community and you have an individual resource, that's also great, but don't just settle for just one person. Keep going, get as many, get another resource, get another agency, as many resources as you can have so that you can always, fill that need.
agreed.
So thank
Yes.
you so much again, and we
Thank
just
you.
really appreciate the work you've done. And Maria, again, thank you to you for being another just wonderful example of, you know, for all Indigenous and lower diffusion language interpreters to, not let go of your cultural heritage, and also in addition to not just not letting it go but using it for good to help people, that both of you I think are really the embodiment of what we need, which is you care about people and you work hard to help, and at the end of the day that's what makes all the difference. So
Thank
thank
you.
you
Thank
both of
you. Thank
you.
you, Brandy. Thank you for
Thank you,
joining us.
Maria.
Thank you, Jace.
So,
Appreciate you.
yeah, thank you. And thanks to all of our listeners. Please stay tuned for a lot more to come. As we mentioned, we are going to have a webinar in Spanish for Indigenous language interpreters. And I think maybe, Maria, we should do a podcast in the Spanish language to get ready for that. And then we will also be working with people like Brandy to have other types of information that we can publish on what's best protocols for organizations to implement as far as finding, when you find resources or you find patients that have limited proficiency in languages like Spanish, what do we need to do? So stay tuned for
Yes.
that. And thank you all again. And we will see you on the next episode.
Yeah, have a great day, everyone.
Thanks, everybody.